One Thursday evening, another Thursday evening, a new month. We're still in coolish weather, although it's been quite a nice. It's actually been quite a nice week. So today in Facebook Live, I'm going to talk about one of my favorite topics, which is hip dysplasia in dogs. And the reason I find this topic so fascinating is because I believe it's one of those conditions where physical rehabilitation can absolutely make a difference in both the early phases and in the later phases. So I'm going to run through what hip dysplasia is and basically the way the disease manifests. We've got kind of like two groups where we see it most often, and then we'll have a look at what it is that that we can do from a physical rehabilitation perspective that can help you. So, hi Christine, thank you for the message. At least someone's present. So hip dysplasia is I always, when I teach the students, I always say, break down the words. So dys means abnormal and plasia means growth. So hip dysplasia is abnormal growth of the hip joint. So what we do know about the hip joint is, hi Siobhan, what we do know about the hip joint is the hip is actually a ball and a socket. And in a normal joint, it's a very nice round ball and a very deep socket. And so as the dog stands on the leg, as the dog moves the leg backwards and forwards, the ball is actually supported by this beautiful socket. And young puppies are all born with normal hips, and hip dysplasia starts as early as 8 to 12 weeks of age. Okay, so when I graduated, it was thought that hip dysplasia was a disease only of old dogs. And what we typically know, or what we did know then, is that, those old dogs suddenly they don't get up. And it's because that malformed hip has now created such a lot of arthritis that it can't move anymore. It's extremely painful. You get bone on bone, and then those old dogs are often called upon, and we're often called upon as vets to put them to sleep. So that was what I knew about hip dysplasia when I graduated, and it's still a fairly common misunderstanding that hip dysplasia is a disease of old dogs. What you see there is the end stage of a condition that is a lifelong problem, and the problem starts in puppies at as early as 8 weeks from when they really start to walk. Okay, so what happens is, and we haven't determined this yet, and I'll run through some of the influences, some of the things that influence the development of hip dysplasia or the malformation of the hip. But basically, if we think about a puppy, and put it this side, as the puppy starts to bear weight, for some reason we get, there's at the top of the hip here, there is a ligament called the capital ligament, and this ligament attaches to the inside of the socket, and it helps to hold the ball in the socket. And what we get in dogs that develop hip dysplasia is we get a lot of laxity here. So this ligament doesn't work so well. The joint capsule that surrounds the hip starts to become lax. And so as the puppy grows and as the puppy bears weight, there's a lot of movement in this joint. Okay, now the less movement we have, the more this, as the dog bears weight, the more this ball in the socket will influence the formation of this socket. The moment we have a loose joint, then this ball has less influence on the depth and the socket and the cup that actually develops. So and skeletons are really malleable. They're very easy to influence positively or negatively. So now we have a young puppy. As it starts to grow and as it starts to bear weight, this ball starts to move. And the less stable it is, or the later we pick the problem up in puppies, the more unstable it becomes. Okay, until eventually you can have a very flat head and a very flat socket, and that can be picked up at 5 months of age. Okay, so don't let your vet tell you the dog has to be 1 year before you can make a diagnosis. That is untrue. You can make a diagnosis of hip dysplasia as early as 5 months, if not sooner. And basically what happens now is that this ball, every time the dog walks, here's the bottom of the leg, every time the dog puts that paw down and the ball moves up, it catches this top part of the socket or the acetabulum. And as the dog gets heavier, the pressures, so in a normal joint, the pressure and the weight is spread over this entire ball and it helps to deepen the socket. In a hip dysplastic dog, the pressures are now all sitting on the top of this socket, okay, of the pelvis. And we then end up with microfractures in this area. Okay, microfractures means it doesn't completely destabilize. But fractures of any form creates a lot of pain. So then the dogs, the puppies, actually start to become really, really sore. And so now that's the second kind of like group where we get manifestation of hip dysplasia, is in young, large breed puppies around about 5 to 7 months of age. And that's the area I work with the older dogs, and we do, for those of you that have been in to see me, you know, we do a lot of laser, we do a lot of acupuncture, massage, we do hydrotherapy if it's indicated in those old dogs, and we really keep them mobile. But the really, really important crux of the matter is with the young dogs. The sooner we diagnose this is my opinion, and it's backed up in some research that's been done in human medicine. If we can influence the soft tissue, in other words, the musculature that surrounds this joint, if we can influence that, soft tissue can influence the long-term outcome of skeleton. So my goal as a veterinary rehabilitation practitioner and as a vet is to be able to get these dogs diagnosed as soon as possible so that I can and my team can actually work on how do we strengthen those muscles, their gluteal muscles, so they're the equivalent of our bum muscles. How can we strengthen those muscles so that instead of this, we start to pull, the muscles start to actually pull that hip or that ball back into the socket. Okay, so I see many young dogs now, unfortunately, that have been diagnosed with hip dysplasia, and I do believe that we make a very positive difference in their quality of life and in their long-term mobility and quality of life. So, Nikki, I see you here. Hello, and hi to everyone else that's popped in and is listening to me. Thank you so much. So that really is that's what happens with hip dysplasia. And the longer we have this instability, the more the body feels, I have to stabilize it. And one of the ways the body stabilizes an unstable joint is to add down bone. Okay, and then that's why now the body's adding down bone, and over time we get old dogs with all those bony changes around the hips. So it's my belief, although we don't necessarily completely stop that outcome, that arthritic outcome, with lifelong exercise, appropriate exercise, I believe we slow down the progression and the formation of that bone. Okay, and I'm waiting for some amazing colleague of mine to actually set up the research project that will take us, and it costs a lot of money to follow dogs from time of diagnosis for 10 years. So we're hoping some great American company is going to sponsor some research in that line. Nevertheless, let's also now talk about what causes hip dysplasia. So first of all, I have to tell you that it is a genetic condition, okay? But it's what we call polygenic. So that means there are many genes involved in the expression of hip dysplasia, not just one. So it's not like something like degenerative myelopathy. It got lots of genes, and what they have discovered fairly recently is that the genes in Rottweilers that cause hip dysplasia in Rottweilers are not the same genes that cause hip dysplasia in Labradors, which are not the same genes that cause hip dysplasia in German Shepherds. So we can't even say, gee, you know, if we sequence this chromosome and we find that gene, regardless of the breed, the dog will develop hip dysplasia. So that's the trick in terms of controlling the problem genetically in our population, is there are just so many genes that influence the expression that it's not been possible to identify them on any level. The second thing is that our grading systems, I'm gonna kind of like stretch a little here. It's my opinion that if a dog has the slightest hint of hip dysplasia on its radiograph, on its x-ray, we should not be breeding with it at all, because we have no idea what genetic composition that dog has. And even dogs that do not, as young adults, display hip dysplasia may actually have some genes in their makeup that will influence the expression of hip dysplasia. So you can have two perfectly good adult dogs, a male and a female. They've been radiographed. They have A1, A+ hips, and you put them together, and there can be a puppy in that litter that has hip dysplasia, because there are so many factors genetically that influence it. Okay, it doesn't mean that there isn't indiscriminate breeding and irresponsible breeding, and that is a topic that's not for this talk. Okay, but genetics does play a role. There are two other factors that are very, very important with regards to the expression of hip dysplasia or the development of hip dysplasia. The first one I want to talk about is nutrition, and nutrition in a young, growing puppy. Okay, so I've touched on this. I think I did speak about large breed puppy nutrition in an earlier talk somewhere like a year ago when I started with Facebook Live. So you can go and look for that. But really, if a large breed or a giant breed puppy is fed too much energy and too much protein in that growing phase from 3 months, literally from 3 months to 6 months, then we get insufficient, the skeleton is so soft that the dog grows so quickly, but there's no substance, that there's no support from the muscle, the ligaments are too lax, and so in that fast phase, that's when a lot of the damage happens. Okay, so and the other thing is that large breed puppies cannot control the uptake of calcium from their small intestine in that period from 3 to 6 months. And so if we give them too much of that, they will absorb too much, and that will result in all sorts of orthopedic or developmental orthopedic conditions, of which hip dysplasia is one. Okay, there's loads of them, and maybe that's a talk for another day. Okay, so be very, very careful with regards to your nutrition, and make certain that your puppy is skinny. If people say to you, gee, don't you feed your puppy? Then you must know your puppy's in perfect weight with regards to its health, its skeletal health. Okay, your puppy will grow to its fullest genetic potential. It will just take longer to get there, and it will be far healthier. The second thing that definitely influences, or the third thing, so the one is genetics, the second one is nutrition, the third one is environment. So environment is what's the surface those puppies are being raised in, even when they, in the whelping pen. What is it? If it's slippery, and you think about what's happening to those legs, they're slipping out all the time, that's not healthy. If the puppies have to negotiate a lot of ups and downs in their area before they actually go to their home, so under 8 weeks of age, let's say, that trauma is going to keep on knocking them. When they go to their new homes, if you have an older dog that is constantly bumping this puppy, you are going to predispose to skeletal problems, and you're going to predispose to hip dysplasia, specifically if the dog has the genetics for it. Stairs. I harp on this in my hip dysplasia course. There is an online course for you that's available on www.drtanyagrantham.co.za. So Dr. Tanya Grantham, all one word, where all of this information and exercises is covered in a lot more detail. But stairs, puppies do not have the neurological development to negotiate stairs until they are older than 12 weeks. So if you have stairs in your home and you have a large breed puppy, then you should not be allowing them to go up and down those stairs until they're older than 3 months. And then when you do allow them access, you should teach them how to properly negotiate those stairs, because when they tumble down, that trauma again, it plays a big role in a lot of joint issues in the dog at a later stage. Okay, so those are the factors that will influence hip dysplasia in young dogs. Now, I have harped a lot on large breed and giant breed. Typically, we see it in Rottweilers, German Shepherds, Labradors, Newfoundlands, St. Bernards, Bull Mastiffs. I mean, the list goes on. But I have to tell you that it is not restricted to large breeds. So I see many Cocker Spaniels with hip dysplasia. I see many pugs with hip dysplasia. I also see quite a few poodles. So my little poodle, I don't know if it's really dysplastic. It probably is. It's not so much a loose joint as it is a malformed one, but it's still dysplastic. So my little miniature French poodle has bad hips. Most of you will know that. So we do need to be aware that poor hip formation is not restricted to large breeds like we thought, 20 years ago. Okay, so the last thing I want to talk about, and I see there have been a few questions about it, so I'm going to cover it and then I'll go to the comments and I'll answer the questions as best as I can. The last thing that we can look at in terms of assisting any puppy, but particularly young dogs with hip dysplasia, is hind limb awareness exercises, okay, and also core stability. So when the puppy is taught to become more aware of itself and is taught to hold itself and hold its posture, and then it's taught to think about where its back legs are, we are automatically asking that dog to use those hind limbs more appropriately and to use them more, which then assists with the building of the muscle. Okay, so in any young dog, I believe a hind limb awareness program is essential, and I see Eileen's on board. So, it was her beautiful flat-coated retriever that was is our model for the puppy fitness course. So I'm sure she can vouch for how well he moves after running through the foundational program. But exercises are important. If the diagnosis is made and your dog ends up at a physiotherapy or a physical rehabilitation institution, then we are really, really well trained in activating the gluteal muscles, in improving the hip extension, because the extension is the biggest issue with regards to the malformation, and generally assist you. So my goal as a rehabilitation practitioner, my goal is first of all to get your dog better and to get those muscles activated and to get him moving. Secondly, my job then, once that dog is stronger and you have watched and participated in the process, then I want to be able to say to you, right, now here's your maintenance program, because the problem has not gone away. We have just mitigated some of the symptoms. So for the dog's entire life, an exercise program and maintenance of that muscle mass and muscle strength is very, very important for keeping that joint as close and as deep as possible. Okay, so yeah, I mean, I could go on for a very, very long time about the surgeries and about all the other things, but we're coming close to the end of the 20 minutes, and I see there's lots of comments. So I'm going to go up to the top of the comments, and I'm going to tackle them kind of like as they've come. So Lisa, if you build hind limb awareness and build hindquarter muscle, would it help in all dogs? Absolutely. So I think I did kind of like answer that. Eileen, so breeders do need to be kept informed. Eileen, they do. I think that there are a number of breeders that really have worked very hard at reducing the genetics or the potential genetics for hip dysplasia in their lines. I think that's all I'm going to say because it's a hot topic. And then Nikki wants to know about raw versus kibble. I think, Eileen, the research that is done on kibble by high quality manufacturers ensure that a puppy's needs are met. Only my thoughts, and I'm not against raw. Yeah, so I do think that that raw versus kibble is a very controversial topic. I think the most important factor is not raw versus kibble, but it's about the value of the nutrients that you're giving the dog and the fact that you are not giving them too much too soon so that they grow too quickly. So you can feed raw and you can overfeed and you can have a puppy, regardless of what you feed it, that could develop hip dysplasia if the genetics is there. And kibble, for sure, they've done a lot of research on the calcium phosphorus ratio. And the reason that large breed puppy foods developed is because they discovered that the puppies could not manage their calcium intake, firstly, and secondly, that if they grew too quickly, they would develop more of these skeletal or orthopedic problems. So a large breed puppy kibble actually is lower in energy than a normal puppy or a small breed puppy food, and because we want to control the rate at which that dog grows. Okay, so can using a vet care photizo and TENS on puppy and older dogs before after a walk hiking, can it help somewhat? Yes, I do think I think I use a lot of I use them both, but one that my clients use a lot is the vet care photizo. And I think that it makes a huge difference. There's a number of people online that actually have one, and I know they use them a lot. Lisa, would a supplement help after a year old? Okay, so Lisa, you need to be careful about how you're supplementing and what you're supplementing. So like Eileen says, most of the kibble these days, the good quality ones, are actually balanced. And I would not supplement necessarily a nutrient. So I wouldn't supplement calcium. I wouldn't supplement phosphorus. What I would look at possibly is a joint supplement. So glucosamine, chondroitin, collagen, green lip muscle. I did a whole 3 talks on that. I think that there is evidence that says chondroitin specifically is a preventive. It helps to maintain cartilage health and therefore joint health. So I think you need to be careful about what supplement. And yes, it will help even after a year old. So I don't know if the photizo and the TENS will help to prevent it, but if you think that it will help to reduce pain and you will get better engagement and movement of that leg, I guess that you could extrapolate that it may assist in reducing the damage. But prevention occurs genetically. Have you got good breeding stock? Prevention occurs in terms of managing the rate at which your puppy grows, and prevention occurs in managing the environment, even if the genes are there. Okay. Shelley, hi. You have 2 beagles from the same bloodline, both with hip dysplasia. Is it likely that it's mostly genetic in their case? Absolutely. So the genes, the genetics needs to be there to create the laxity. And the way that we manage those puppies afterwards exacerbates the problem or not. Okay, Lisa, the what type of exercises? I think that's out of the scope of this talk, and there's lots of. I think there's even a free webinar on my website. So there's a free webinar for hip dysplasia, and there's also a free puppy webinar. So go and have a look at those. Lots of comments about raw. Okay, so Yanka, I interpret the result of hip dysplasia. I'm waiting list for a Labrador puppy, and the parents. So I would ask your vet. If you have the results of the parents, then I would maybe, even if your vet works on an appointment, make an appointment, take them there, and say, what is the chance that the puppy I'm going to get may develop hip dysplasia? And it's not when we screen them and we have dogs with good hips, it doesn't exclude the possibility that they may still somewhere have genes in their system that might result in hip dysplasia. But if they already exhibit hip dysplasia on those x-rays, then we know they have the genes, and it's highly likely, it's highly heritable, those puppies will also have bad hips. So I hope that helps you a little. Liz Turner, hello. Chocolate Lab. So I think what you need to look at in the Hills Digestive Care, I need to see the label. So I really can't comment on whether it's too high. We're look for a calcium to phosphorus ratio of about 0.8 to 0.6. So calcium 0.8, phosphorus 0.6. 1-to-1 will also work. Once it starts going higher than that, then in my opinion, it's too high. 21-month-old lab, severe hip dysplasia. She's extremely active and loves to play. This is Marion Thompson. What kind of games are best for her? All the games that are low impact. So the jumping games, the fetch games, the running games where we've got all of this impact on the joint, very, very bad for your dog. Okay, so low impact, slow walking, hydrotherapy, excellent. And then I would do tracking games and hide and seek games that are slow without a lot of jumping and bouncing. Okay, and if you're looking for a lot of information, visit the websites. I'll put the site up for you now. And Nikki, how do we get over the guilt as pet parents? Nikki, what I can say to you is we do the best we can with what we have. And however we don't necessarily know that the puppy that we get is prone to hip dysplasia. There's nothing you can do about that. Okay, but what you are doing now with your young boy is you are actually taking responsibility now that the diagnosis is there, and you're doing the best you can. And I think that's the best advice I can give anyone is, I've mentioned a very short, there's so much information on this, but really excessive high impact is exercise is going to worsen it. You know that if the dog has got severe hip dysplasia, chances are, and this is for you, Marion, chances are also the dog has shifted onto its front legs and not actually engaging the hind legs properly. And that's why a good physiotherapy or physical rehabilitation consultation can at least point these things out for you and move you in the correct direction with regards to exercise. And I'm generalizing, every dog is different, and I stress that over and over and over again. And that's why I want to see the dog, I want to get my hands on the dog, I want to watch it move, because that allows me to see what is your dog doing. There's generalizations, but how is your dog behaving? How is your dog moving? And then I can talk about a program around what I see and feel in your dog. Can an overweight dog be prone to hip dysplasia? Yes, because if the puppies are overweight, they are growing way too fast. All of those joints are susceptible to joint issues and joint damage. okay? But overweight will not create hip dysplasia. The genetics needs to be there, okay? And if any of you have dogs with joint problems and they're overweight, if you don't want to carry guilt, that dog must be as slim and as lean as you can possibly get it. That's the best piece of advice I can give you. Cool. Eileen, it's a great pleasure. I think you can see this has gone on for a while. It really is a topic where I feel there's so much that we as rehabilitation practitioners can impart to you, to empower you, and to to give you information that allows you to do the very best that you can in a lousy situation. And you definitely can. I've seen it over and over and over again. So thank you everyone for your interest and your participation. I do love it when there's a lot of backwards and forwards. Next week I have a very special guest. Her name is Catherine Brown. She is a animal behaviorist, and we're going to be interviewing her and hearing a whole lot more about what we can do to assist dogs that have got behavioral problems. Have a very, very splendid evening and a great weekend. Look after yourselves, stay safe, and I'll see you next week.